NAD supplementation through vitamin B3 derivatives such as nicotinamide riboside, NR, nicotinamide mononucleotide, NMN, nicotinamide, and nicotinic acid has garnered increasing attention for its potential to support longevity, mitochondrial function, DNA repair, and metabolic health. While the benefits are compelling, one of the most important questions for both researchers and consumers is long-term safety. Fortunately, a growing body of scientific evidence suggests that NAD boosters are generally well tolerated, with a favorable safety profile across a range of doses and durations, though careful consideration of form, dose, and individual health status remains essential. Clinical trials over the past decade provide the bulk of our understanding of NAD safety. Studies using NR and NMN in healthy adults, older populations, and individuals with metabolic stress consistently report excellent tolerability, even at relatively high doses. For NR, doses ranging from 250 mg to 1,000 mg per day over periods of up to a year have produced minimal adverse effects. Most commonly reported issues are mild and transient, such as slight flushing, nausea, or gastrointestinal discomfort, and these are generally self-limiting. NMN trials report similarly mild side effects, with doses of 300 mg to 600 mg per day demonstrating no serious adverse events. Importantly, blood chemistry, liver and kidney function, and markers of inflammation remained stable or even improved during these trials, suggesting that NAD supplementation does not impose measurable stress on key organ systems over months of use. Niacin, an older and well-studied form of vitamin B3, has been used for decades to manage cholesterol, and its long-term safety profile is well established. Its main side effect, flushing, can be minimized with sustained-release formulations or combination therapy. Nicotinamide, which does not produce flushing, has also been used safely in high doses for dermatologic applications and for prevention of certain cancers, such as non-melanoma skin cancer. Collectively, these data suggest that all major forms of NAD supplementation can be administered safely when appropriate doses are selected and clinical guidance is followed. Another important consideration is dosing relative to NAD physiology. One reason NR and NMN are often preferred over traditional nicotinamide or niacin is their efficient conversion to NAD in tissues without overwhelming methylation or detoxification pathways. Excessive niacin intake, for example, can stress liver function at pharmacologic doses, whereas NR and NMN appear to elevate NAD effectively while imposing minimal metabolic burden. This distinction highlights the importance of choosing the appropriate form and dose for long-term use, especially in older adults or individuals with pre-existing liver or kidney conditions. Ongoing long-term studies are particularly encouraging. Several multi-month and multi-year trials are now investigating NR and NMN in diverse populations, including older adults, individuals with metabolic syndrome, and those at risk for cardiovascular or neurodegenerative conditions. These studies are assessing not only tolerability, but also biomarkers of cellular health, metabolic function, and inflammation. Preliminary data indicate stable NAD levels, improved mitochondrial efficiency, and minimal adverse events, reinforcing the notion that long-term supplementation is feasible and safe when monitored appropriately. Moreover, emerging research is exploring combined strategies, pairing NAD boosters with exercise, dietary interventions, or other anti-aging compounds, which may further enhance benefits without compromising safety. Another positive aspect of NAD supplementation is the potential for systemic resilience. Because NAD supports DNA repair, mitochondrial function, and metabolic homeostasis, restoring its levels may improve organ function and reduce age-related vulnerability over time. This means that long-term supplementation could confer benefits beyond simply maintaining NAD levels, potentially helping to preserve cognitive function, cardiovascular health, muscle strength, and metabolic stability. By reinforcing the body's natural repair and energy pathways, NAD boosters offer a low-risk method for supporting overall resilience, which is particularly valuable in aging populations. While the existing data are encouraging, experts emphasize the importance of individualized approaches. Factors such as baseline NAD status, age, genetic predispositions, lifestyle, and concurrent medications can influence both the safety and efficacy of supplementation. Periodic monitoring of liver and kidney function, metabolic markers, and overall health status is advisable for long-term users, particularly when higher doses are employed. Additionally, research continues to define the upper limits of safe long-term dosing and to explore potential interactions with medications or other supplements. In conclusion, NAD supplementation using NR, NMN, nicotinamide, or nicotinic acid appears to be safe for long-term use in healthy adults and aging populations, with most reported side effects being mild, transient, and manageable. Clinical trials to date show stable organ function, minimal adverse events, and improved biomarkers of metabolic and mitochondrial health. Ongoing studies continue to expand our understanding, supporting both safety and potential systemic benefits, including enhanced energy metabolism, DNA repair, and resilience to age-related decline. While individualized monitoring is recommended, current evidence positions NAD boosters as a well-tolerated, scientifically supported strategy to support cellular health, longevity, and overall vitality over the long term.